Hello, everyone. This is Eva Norlick-Smith with YogaU Online, and I am so excited to welcome all of you to this talk with Doug Keller, yoga therapist and author and very distinguished yoga philosopher. Doug has been a yoga teacher for more than 25 years, and he is a student of yoga who has really steeped in the knowledge of yoga, meditation, and the deeper philosophies of yoga for the better part of 30 years. Doug, I think you're probably one of the most distinguished teachers we have in the fact that you not only bring a lot of knowledge about yoga, but you combine it with a very, very deep understanding of Western philosophy and Western anatomy. And it really brings to your teaching this wonderful integration of yogic knowledge, yogic perspective with cutting edge Western science, which is what we're about to enjoy now. So let's dive in. Doug, welcome again. Thank you so much. So we're here to talk about the back, the importance of the back, and how to avoid back pain and how yoga can help us keep back pain at bay. But before that, let's just take a look at how the ancient yogis viewed the spine, because there's this yogic saying, the body is as young as the spine is flexible. Is that just kind of like something they threw out there, or is there a deeper perspective in that simple quote?
I think, especially if we're looking at the earlier yogis, I mean, they didn't really speak anatomically that much. So when they're talking about the spine, they more often use terms like the central column, which in one respect refers to the anatomical spine, but in a deeper sense, it goes into the realms of thought, consciousness, intention, emotion, all of which I think are really relevant and get left out when we start to think just literally in terms of the physical spine, the bones themselves. And so the flexibility, the central channel, or the focus on the central channel they're talking about, I think is speaking as much to the nervous system and the ability to master the tendencies of the nervous system as much as they're talking about the physical spine itself. And emotion, thought, intention comes in to the health of the lower back as well. And certainly today we're talking about chronic pain in the back, in the spine, and there are more issues to it than the physical. It's kind of my intention today, since a lot has been said about what yoga does that's good for the spine and the usual things that are emphasized like the abdominals, some of the other muscles, all of that is true. And so I'm going to focus on 5 points that are maybe less commonly spoken of, but give us insights into how to make our asana practice, combined with pranayama, combined with the breath, a bit deeper to speak to the sort of deep flexibility that, like you're saying, the yogis were talking about. They didn't really use the term spine that much, though that's how we interpret it, and it's not entirely inaccurate to do that.
And I think when we look at this phenomenon of back care, back pain, back health, certainly in the Western system, the importance of the back is acknowledged for obvious reasons. It houses the central column of the nervous system. And so it's not just our structural support center, it's really, as you said, essential for a healthy nervous system functioning. But when it comes to what we're taught in terms of wellness activities to stay healthy as we get older, it's almost like there is a gap there. We learn like we have to take care of obviously our nutritional quality, of the thinning bones of the spine, of the muscles that are getting that are wasting. But we never hear about, well, you really need to take care of the health of your back. And at the same time, we know that these gazillion back issues that really undermine people's quality of life as they get older, they are decades in the making, right? They're caused by certain degenerative processes in the spine that we actually can address. Do you want to talk a little bit about that? Why is there that gap, and what can we do about it?
As far as maintaining the health of the spine,
Yes.
we're going to look at some of the features of how we use our bodies, our posture, our movement, which tend to make life a little bit hard on the spine, and what are the aspects of our musculature and our ligaments that are meant to stabilize the spine and hold it in its natural curves. All of that's supported by yoga practice. And again, I want to focus on some of the less commonly discussed topics having to do that with that, particularly the topic of twisting, which I think is very essential to the health of the spine and is not focused on enough and sometimes even avoided. I remember I had one student, I was teaching in one conference and I had a number of people in the room who were older. A couple of women were in their late 80s, early 90s. And one woman said, you know, my doctor tells me I'm getting older, so I should stop twisting to protect my back from injury. And I said, probably some good advice in there, but maybe ask the doctor if you're getting older, if people are getting older because they're not twisting. It's not, don't twist because you're getting older, twist and you won't get older so fast. And so it's an essential component to the health of the spine. And I wanted to point out that we actually have two distinct systems to the nervous system. The nerves that run through the spinal cord and through the spine are called spinal nerves because they run through that circuit, control the muscles of the body, control our reflexes, deliver information from the senses, and it's more linked to the sympathetic nervous system that we'll talk about some today. There's a distinct set of nerves called cranial nerves that go directly from the brainstem, don't go through the spinal cord, but rather exit directly into the head and the face, and also through the most famous of the cranial nerves, the vagus nerve, goes down through the two sides of the throat into the body and reports information from the internal organs, the state of the internal organs. And it's meant to establish and reestablish the parasympathetic nervous system, which is our relaxation response. And so sympathetic is fight or flight. Parasympathetic is our normal way of functioning, homeostasis, or basically rest and digest. And the nerves that the yogis were stimulating, particularly through pranayama practice and the bandhas and mudras that came with it, were the cranial nerves, particularly with their emphasis upon Ida and Pingala. I think Ida and Pingala correspond to the branches of the vagus nerve and the influence they're seeking to have upon what they call the nadis, we call the nerves, in order to establish a state of sattva or homeostasis or a normal state of functioning, was through influencing these two nerves. And previous to the Hatha Yogis, you don't find the yoga literature talking about Ida and Pingala. There's a sense of the central column from the heart that goes all the way back to the Katha Upanishad, and eventually that turns into the Sushumna. So there is that sense of the center, which we started out saying could correspond to the spine in the sense of talking about a healthy spine. But there's this other distinct set of nadis that yoga speaks to in particular. And I hope to touch upon today how profound that is for the health of the lower back, especially in dealing with chronic pain problems.
Great, great. Yes, so why don't we dive straight in? If we don't want to suffer from back pain and loss of mobility and neck pain and shoulder pain and digestive issues and all the other things that are linked to chronic back pain, what can we do to prevent something from developing down the road?
I'm going to hop right into it, and you're a little bit optimistic in saying this would take half an hour. I'll save time for questions, but I think people are going to be interested in this too. And to help share this visually with people, I'm using a set of slides to illustrate the points that you'll also be able to refer back to in the recording. Sometimes it's when you visualize the points and see them written down, it's a little bit easier to internalize in addition to having heard it. So I'm going to be touching upon basically 5 points or 5 things that impact the health of the lower back that yoga actually does address in different ways, and will be certainly part of what I do with YogaU in the future here. So we're looking at keys for a healthy back through yoga. And I want to start by touching upon something I was kind of alluding to, because in the case of the back, more often than not, we're talking about chronic pain. And chronic pain is different from acute pain. Acute pain is a sharp localized pain, and it signals some kind of tissue damage, whether it's through an injury, a trauma, infection, a disease, inflammation. That kind of thing requires diagnosis, and that's the thing that you go to a doctor for. If the reasons for your acute pain are not obvious, they use different diagnostic techniques to find out what the actual cause is and see if they can fix it so the body can heal from that injury leading to the acute pain. Chronic pain is different, and it operates by different rules. And this is part of the explanation why many of the traditional therapies for back pain, such as surgery, have a much lower success rate than the medical community has in other areas where you can make a clear diagnosis as to the cause of a person's problems. And so we have to look at how the nervous system functions in relationship to pain to understand what's going on. And then we start to understand how aspects of yoga practice form a good partnership with medical treatment to really address the elements of the pain problem of the lower back that normal diagnosis can't quite put its thumb on, because a lot of people do suffer from chronic back pain. I forget the actual figure. It's a very high percentage. They go to the doctor for a diagnosis, and often the doctor says, I don't quite see what's wrong with you. Or they might find something like a ruptured disc, do a surgery to fix the disc, but the person still has the back pain after the surgery, which means the usual normal corrective technique didn't quite do the trick, because there's a different mechanism at work here. So chronic pain seems to involve a dysfunction in communication between the peripheral nervous system, and that's the part of the nervous system that gives a sensation from the senses, reports information from the muscles, basically tells the brain what's going on with the body. And this includes the autonomic nervous system. And the autonomic nervous system governs the automatic functions of the body that we don't have to think about, like breathing, heart rate, digestion, all of the things that go on in the body without our consciously directing those processes. That's governed by the autonomic nervous system. And that's part of the peripheral nervous system. It reports back to the brain on a sort of preconscious level about how digestion is going, how the breathing is going, so on and so forth. And then the nervous system, the brain stem make an adjustment in response in order to maintain or reestablish normal function. But there's a breakdown in the cases of chronic pain between that kind of communication from that aspect of the nervous system that reports back to the brain and the central nervous system, which is the part of the nervous system that responds by telling the heart to speed up or slow down, breathing to speed up, regulates digestion, so on and so forth. And usually at the center of this breakdown is sympathetic activation of the nervous system. In other words, you're under stress. You're in fight or flight mode. It might be constant low-level stress from your job, from your kids, from other kinds of worries. When that becomes a persistent state, because temporary sympathetic activation is fine, but it's meant to be temporary. We're meant to return back to parasympathetic or normal functioning. We can get stuck in sympathetic activation, and that's where the communication between these two sides of the nervous system starts to break down, and it has consequences for the body, especially that lead to pain. Because one of the manifestations of this breakdown of communication is that the body continues to produce inflammatory compounds, because part of our response to sympathetic activation is defensive in our immune system. If you have a pathogen, if you catch a germ, a virus, you're starting to get sick, or you've cut yourself and the body's trying to heal and reduce infection, it creates inflammation, because inflammation in the body, the increased heat, tends to kill off the germs and help us to repair ourselves. And so part of sympathetic activation is a release of these inflammatory compounds. For the medical nerds among us, I gave a whole list there, which include immune cytokines, which are involved in fighting disease. It's what's called a whole inflammatory soup, which again is part of the natural process of healing, but under a situation of sustained stress, it's a sustained release of these inflammatory compounds until that becomes your basic state of operation, even after any obvious threat has passed or subsided. And in dealing with this inflammation in the body, it tends to fatigue us and can even immobilize us because it's linked to pain and pain syndromes as well as emotional manifestations. So the problem of chronic pain is less a problem of healing from an injury or disease or infection in the normal sense. That's what happens in the case of acute pain. Instead, dealing with the problem of chronic pain involves a kind of retraining of the brain with regard to pain, as well as retraining our responses of the autonomic nervous system. And this means getting back to the adaptability by which we can come back to a parasympathetic, or the yogis would say sattvic state, after being in a temporary state of sympathetic activations. And the communication between the nervous system and the organs of the body and the organ functions takes place through a whole batch of neurochemicals, which includes hormones as well as neurotransmitters. And the majority of these are, interestingly, produced in the gut. And the autonomic nervous system exerts control over what kinds of hormones are produced to create certain reactions in the body. A good example is adrenaline. When you're in a heightened state of sympathetic activation, your body produces more adrenaline to speed up your heart rate, your breathing, so you can deal with the threat. And we still have adrenaline being released when we're in a parasympathetic state, but it's more to maintain a sort of state of homeostasis or normal state of functioning. When this system of hormonal release is persistently disrupted by sympathetic activation, we go into what's called allostatic overload, which means there's a constant dumping of these inflammatories into our system. This is one feature of why some people prove to be more vulnerable to COVID than others in terms of serious symptoms, or even symptoms serious enough to put the person in the hospital. People with pre-existing conditions that put them at risk from COVID, those conditions usually involved one form or another of inflammatory states of the body or sympathetic activation. That made them more vulnerable to what's called a whole cytokine storm, which is an overproduction of inflammatories. So there's that aspect that affects our immune system. And beyond that, with all of these compounds being released, it makes us more prone to depression, to anxiety, and also changes our relationship to pain. We become much more sensitive to pain. Our pain threshold is lower, and we can't manage pain as easily. And certainly that speaks to problems in the spine or problems in the lower back having to do with back pain. So I want to talk about a few factors, the first of which I think is the least discussed in a deep way, which is deeply, deeply relevant to chronic back pain. And that factor is the breath. Now, in one sense, the more commonly recognized connection between the breath and the reduction of chronic back pain focuses on how the diaphragm, the movement of the diaphragm during diaphragmatic breathing, good, healthy breathing, that tends to massage and release tension in the muscles that are otherwise going into spasm in the spine, causing back pain. We'll talk about the psoas in particular. So back pain from muscle spasm, chronic back pain from muscle spasm is addressed first and foremost by the breath, and in ways that go beyond just that sort of mechanical massage. I think a deeper and more profound connection lies in how the breath works in concert with the nervous system in the way that I've started to suggest to help to moderate between our parasympathetic states, the rest and digest, and the sympathetic fight or flight states of the immune system. And with that, helps to regulate the hormones that are produced to help moderate pain. Dopamine is produced in a sattvic, relaxed state. And it's also, interestingly, very closely allied with intention. Dopamine is that good feeling that you get when you make a strong intention to do something good for yourself. January is a good month for dopamine. People make their resolutions and they get an immediate reward from the hormonal system saying, that's good, go for it. Of course, we have a habit of making one intention, not following through on it, then we make another intention and we get little hits of dopamine, but we don't get a sustained bunch of it. The other side of hormones that are released are norepinephrine, which acts upon the nerves. When people say you're getting on my nerves, it's basically saying my body's producing norepinephrine and it's making me irritable, or I'm on my last nerve. With that, with stress, cortisol is released, and cortisol, our stress hormone, is used to convert norepinephrine into adrenaline, which acts upon the organs, and then the body overall gets jazzed up in that sympathetic state. Again, the breath has a deep connection with the nervous system in helping to moderate between being in sympathetic states and returning back to parasympathetic states. And so one of the pathways to dealing with the hormonal states of the body is through the breath, and through that, dealing with pain. So the connection between the breath and the autonomic nervous system is a key to how we experience pain and also how we manage pain. And chronic pain in the back is often pain that we're feeling, but in a sense, we don't need to be feeling it because there's nothing physically wrong in terms of tissue damage. Rather, it's a fatigue state of the muscles, an overused, a weakened state of the muscles, as well as muscles responding to instability in the body. People take muscle relaxers to help relieve those spasms, but if we haven't dealt with the instability or with the states of the nervous system, once the muscle relaxer wears off, we go back into spasm and go back into experiencing this pain. So there has to be a better way to manage the pain than simply dealing with muscle relaxers. And with each of these points, I'm being suggestive about what we need to pay attention to. And each of these points can be gone into in greater depth to see how they work, and also to be shown how to actually put this into action for your own sake. A little bit too much to do in this meeting here today. But I've been suggesting the breath as it's treated in Hatha Yoga, pranayama, particularly with this emphasis upon the nostrils, as well as upon the Ujjayi breath. This is meant to be a stimulation of the autonomic nervous system, or they speak of it as removing blocks in the nadis. And I think of their language about blocks in the nadis is in part addressing the block to the communication between the body and the mind, or between the body and consciousness. When there's a breakdown in that communication because of rajasic or sympathetic states, then the body doesn't function as well. So these blocks in the nadis that were removed through things like nadi shodhana are done through the breath. And on the left, you see an anatomical illustration that shows the cranial nerves, especially, you can see they exit from the brainstem through a space at the base of the skull, and two branches, the vagus, go down into the body from there. And a lot of other branches you can see collect around the larynx, the voice box, the throat, the trachea, as well as the jaw going into the face, and branches of it also going into the nostrils, both on the inside and on the outside. And so when you're doing digital pranayama, touching the nostrils, directing breath through the nostrils, you're directly stimulating cranial nerves that report directly back to the brainstem and play a role in altering states of the nervous system. That's why it's so effective for communication. These are aspects of the breath that are not necessarily emphasized as much or as clearly in modern breathing practices. And modern breathing practices outside of the realm of yoga certainly are compatible with most of the yoga ideas about the breath, but they also leave out aspects that the yogis were getting at in a subtler way. So there are the pathways in the nostrils. There are also pathways in the throat affected by alignment. When somebody has tension in the neck, it cuts off that connection to the cranial nerves going through that space I just mentioned. It also has branches in the soft palate and the throat, as well as going down from the throat to the heart and the diaphragm. And these are stimulated through the Ujjayi breath. The actions in the throat that you create to produce the Ujjayi breath create a calming and soothing response to the autonomic nervous system, supporting these sattvic states. Another practice is called Brahmari, where basically in the exhalation you hum like a bee. And it's that humming that produces a calming response. And they have shown in experiments how that does bring people fairly quickly into a state of not only parasympathetic activation, but even meditative states. So all of these aspects of the yogic breath practice are very profound in affecting the nervous system in this way. So that's the realm of the breath. That's a whole afternoon in and of itself to really get into it. But it's a vital part of what follows with everything else I want to discuss. To look directly at the spine, and as Eva was saying, the yogis were emphasizing a healthy spine, a flexible spine. We need to understand the structure of the spine. We usually think of it as a stack of vertebrae with discs in between, and the stability of the spine is thought of in terms of the strength of the vertebrae themselves and that kind of column of vertebrae that create the steady center of the body. The principle by which the spine maintains its health, integrity, and also flexibility is actually an architectural concept called Tensegrity. There are a couple of examples on the left here. The term may be familiar to you with that sculpture made of strings and sticks. You can see the entire form of the sculpture is created by the relative tension in the strings that hold the sticks relative to each other and creates the shape of the sculpture. If you change the tension on the strings, you'll change the shape of the sculpture. If you cut one string, the whole thing might fall down on you. On the left is a representation of the spine where you can see through muscles and ligaments, the vertebrae are actually held away from each other by the relative tone of the muscles and vertebrae, such as to minimize the pressure on the discs and minimize the pressure upon the vertebrae themselves. The integrity of the spine is established by the network of muscles and ligaments surrounding the spine, outside of the spine, and depend less upon the spine itself. So when we have problems in the spine, like a herniated disc that might start to press upon a nerve, or a subluxated or dislocated vertebrae, it's from a failure of that tensegrity structure to hold the spine together. So when we're looking at maintaining the health of the spine and also maintaining the space of the nerves so the nerves don't get pinched or impinged upon, we're really looking at maintaining the health of this tensegrity structure of the spine. With that comes flexibility, the ability of the spine to move, as well as space and freedom and integrity of the spine, the ability of the spine to hold its shape with minimal effort and at the same time with maximal freedom of movement. And people with chronic back pain gradually over time lose that flexibility, lose that movement, because they're actually losing the tensegrity of the spine. And because of that, then they suffer problems again with the discs, even deterioration of the bones. I'll mention as a side point, in addition about the breath, our breathing patterns have an effect upon the health of our bones. There's a book put out by Leanne Chateau about breathing pattern disorders, where they're showing experiments with people that tend to hyperventilate or overbreathe, which happens with people with a very collapsed posture. They don't breathe diaphragmatically, they breathe with the chest in an inefficient way. It affects the chemistry of the blood, making the blood more alkaline. And this, along with other things, increasing the sensitivity of the nerves to pain, also starts to leach calcium from the bones. So part of the weakening of the bones in the spine that come with osteoporosis, osteopenia, in addition to mechanical factors like pressure and posture, it can be a chemical response where calcium is taken away from the bones because of the alkalinity in the blood. And that calcium is passed out through the urine. So again, the breath has a profound effect upon the health of the spine, even in a physiological sense. And so muscle spasms, back pain, as well as deterioration of the bones, cartilage, and ligaments, all of this can come about as a result of instability from a distortion of tensegrity. And the emphasis in yoga upon movement as well as stability and the kinds of exercises that are practiced, including the breath, are meant to maintain and augment this tensegrity. So the breath is first point. Second is to look at a couple key muscles in the spine. Certainly people have likely heard a lot about the psoas as being important. I'll touch upon that. There's another set of muscles that are rather vital to the health and the alignment of the spine, and these are called the multifidi, or you can call them the multifidus muscles. There's one set of multifidus muscles for each segment of the spine, except in the sacrum, where they overlap, and they're largely responsible for holding the curves of the spine and also holding the vertebrae in place. Now, in the animation on the left, you'll see the skeleton go into a little bit of a back bend. That's an activation of the multifidi. When you bend forward, and this guy is kind of rounding his back as he goes forward, you can see this flexion of the spine and of the neck. That stretches out the multifidi, but watch the action as the spine comes back up. These muscles contract in the neck as well as the lower back to return the curves of the spine. So small back bending, little what I call baby back bending, is healthy for the multifidi. You don't have to do a super deep back bend to address these muscles. And so even a level 1 yoga class, just starting out in yoga, the essential bread and butter poses are really vital to maintaining the health of these muscles. The second animation actually shows how vital these are to the lower back in particular, though they're vital to the neck as well. It comes from a website about weightlifting where the point is don't pick up heavy things with your back rounded. Because when your back is rounded, the multifidi are stretched out like you saw in the animation, which means their action upon the spine is weaker. And because they become weaker, this starts to allow the vertebrae to slip around in a way that's not healthy for the spine. So when they're weak and the back is rounded, you can see this sliding, the spondylolisthesis of the vertebrae, and the flames tell you that's a bad thing. That's the beginning of back pain. The multifidi pull upon the spine in this way. See Mr. Multifidus there sitting on the spine, pulling the vertebrae towards the sacrum and the sacrum towards the vertebrae in a way that not only establishes the curves of the spine, but also restrain the vertebrae from slipping forward. When they do slip, this is what's squeezing on the discs, pressing them back towards the spinal cord, causing problems of a herniated disc, which can cause numbness in the nerves or nerve pain. So if you keep the multifidi healthy, they allow you to move and at the same time stabilize the spine so you don't get into problems of things slipping around. Basically, they're strengthened by gentle back bending actions, especially against some kind of resistance. And the main kind of resistance in yoga, of course, is usually gravity. And the different forms of back bending, especially lying on your stomach, lifting your legs, lifting the upper body, address these muscles of the spine. The psoas muscle, in the illustration on the right, on the left, you can see the multifidus muscles running along the back of the spine. And to the side of the spine, next to it, is the psoas. This is showing psoas major that connects from the spine, goes through the pelvis, over the pubic bone, the hip joint, and attaches to the inner thigh. The psoas works from the sides of the spine to stabilize the curves of the spine. So it works in conjunction with the multifidi, but the psoas is also involved in kinds of movement that the multifidi don't necessarily do. It's involved in side bending, along with other muscles going this side, that side. It's also involved in rotation of the spine, turning especially the lumbar discs. And of course, it's also involved in hip flexion when you bend at the hip to lift your leg up or take a walk. One of the best psoas releases is to go out for a walk and breathe nice and diaphragmatically. That's like a full body massage and psoas release. But because there are two psoas muscles, one on either side, there can be an imbalance between them. And if one side is tighter, along with other muscles that cause side bending, such as the quadratus, this pull of a tighter psoas on one side can start to distort the spine, causing it to bend sideways and also causing it to rotate. And in the extreme, this would be a scoliosis, which is a side bend of the spine with rotation. And this comes from postural habits, especially, as well as movement habits. So balance between the two sides is necessary with the psoas. And it's important to recognize that there are different manifestations of a tight psoas. What we're more familiar with, or at least yoga teachers might be, how we envision a tight psoas is more like the woman on the left, where she's more lordotic and the spine is more arched. The psoas is such a big, long muscle, you can actually divide it into different parts, a lower and an upper part. And the balance of tone between the lower and upper part helps to establish and maintain and stabilize the natural curves of the spine, both the inward curve of the lumbar spine and the outward curve of the thoracic spine. On the left, you can see if a person's lying down with the legs stretched out, the lower part of the psoas, going from the inner thigh and attaching to the lower vertebrae, pull in a way that contribute to tilting the pelvis forward and arching the back. You can see the other fibers that go way over to where the ribs start, they get stretched out and they have to release in order to allow the back to come into its natural curves. So in that position, the upper psoas is a little bit stretched out while the lower psoas is activated. When there's an imbalance in tone, you have a posture like the woman on the left who is more lordotic and with that has a forward tilt to the pelvis. Though the psoas does not attach to the pelvis itself, it influences the pelvis to tilt. By the same token, along with the abdominals, if people do abdominal exercises, they can possibly tighten the upper part of the psoas in a way that weakens the lower. So second manifestation of a tight psoas is the guy on the right. He looks like he's been working on his abs a little bit more. Put that together with tight hamstrings, then you have the pull of the upper psoas, which causes the spine to flex forward and also causes the lower part of the psoas to become weaker. And often that person, in the extreme, if you imagine an older person with a very rounded back, perhaps walking with a cane or walking with a walker, that person kind of shuffles his feet because the psoas can't sufficiently participate in hip flexion. The body's in such a position that hip flexion doesn't come easily. And so the feet just kind of shuffle instead of walking in the normal way. So the guy on the right, he's going to have his own kind of back problems if the spine goes into flexion. And there is a kind of compression on his back taking place, areas of his spine, which is different from the compression on the back of the woman, but they're both suffering from problems of tightness in the psoas, which needs to be released and the muscles need to be brought back into balance. And the effect of the psoas is compressive. It starts to, when it's tight, create more compression upon the vertebrae and the discs, which is obviously going to have a result, like we saw in the previous animation. And the guy on the right with more flexion in the spine may have more problems with a weakening of the multifidi that allow the problems to come up that we saw. It's also the case when the back is overly lordotic, the multifidus muscles are so cramped together that they actually can't perform their function of aligning the vertebrae. So somebody hyperlordotic, like the woman on the left, can suffer from a spondylolisthesis where the vertebrae slip forward. And again, the multifidi are so cramped that they can't pull a vertebrae back into place once again. So both people can suffer from back problems from that kind of misalignment. And it's always worth pointing out that the psoas is a very emotional muscle. Our response to shock or stress or trauma is to go into a defensive crouch, rounding forward. And the contraction taking place inside is not only on the outside in the abdominals, the psoas itself contracts in a way that brings us into flexion and again creates this sort of compression upon the spine. When the body crouches, we also lift our head to look forward and see what's happening, so we get neck tension from that. And this comes, of course, with sympathetic activation, and it's tied very much to emotional states, especially defensive emotional states. So chronic pain, chronic stress is related to chronic back pain because under chronic stress, you get that chronic compression that leads to the problems in the spine. So a release of the psoas is as much an emotional release as it is a physical one. You don't just jump in and stretch it like a hamstring. It doesn't quite respond in the same way, though a hamstring does respond to stress too. But with the psoas in particular, it being a very tender, if you will, emotional muscle, we kind of invite the psoas with the support of the breath to relax and let go. And with that message of relaxing and letting go, it supports the nervous system overall in returning to a relaxed parasympathetic state. So in a sense, with yoga poses, we're seeking sattva in the psoas. And it's worth mentioning what a released, relaxed psoas feels like, because it very much corresponds to the qualities of the parasympathetic state, the sattvic state of the nervous system, a very relaxed, fluid state. Circulation to the pelvis is good when there's less compression from the psoas. This supports the normal functioning of the gut, of digestion, so you have better digestion. And with that, a more efficient maintenance of the hormones produced in the gut by which the body maintains its well-being and at the same time manages our pain states. Again, this is a profound thing because they've shown that women in their cycle at various points in their menstrual cycle can be more sensitive to pain or less sensitive to pain because of the release of different hormones during the cycle. So our susceptibility to pain, chronic pain, is very much tied to the hormones being released, which again are also related to the breath. So a relaxed psoas supports what's called the enteric nervous system, which governs digestion and the release of hormones. There are actually three systems of the nervous system: parasympathetic, sympathetic, and enteric, the gut, which has an enormous number of nerve endings of its own within our intestines, within the organs, that create its own information network. So when people talk about listening to your gut, that's actually a literal truth, to be sensitive to the messages coming from the gut. And it's interesting how much the Hatha yogis, unlike any yogis before them, emphasize the health of the gut as being essential to even achieving meditative states, or in other words, achieving a constructive state of the nervous system. So the feeling of a released psoas is a feeling of being grounded. We feel rooted through our foundation because there's that release from the spine down into the legs. Instead of being pulled away from the earth in a defensive position, we feel released and grounded. And by the same token, there's a feeling of an upright posture. The spine unfurls upwards in a very relaxed, uncompressed state with a feeling of spaciousness, expansiveness in the body, a feeling of consciousness, awareness, fluid movement, easeful movement, and a sense of connection to the body. Again, a tight psoas creates a sort of disassociation from the body that often comes with trauma, or a sense of separation from the body. That feeling of being connected to the rest of the body, a good part of that comes through the psoas. So there are a couple ways in which we can support these muscles, just suggestions here to practice with. The psoas participates in the breath, and the very movement of the breath, when we allow the spine to move and undulate with the breath in a relaxed way, happens most often during reclining, we allow the psoas to move the spine in a way that supports the movement of the diaphragm, supports diaphragmatic breath, and at the same time gives a massage to the psoas that allows it to release its tension. You can kind of play with this, especially if you go back and review the slides with a recording. As you breathe in this case, in reclining posture, the spine tends to arch a little bit because the lower psoas is contracting to arch the back to make space for the diaphragm to descend with the in-breath. And with that, the upper psoas gets a little bit of a stretch and release as the lower psoas contracts. By the same token, on the exhalation, you actually feel the spine lengthen a little bit. It's like you get longer through the tailbone and longer through the crown of the head. And in that case, the upper psoas slightly contracts and the lower psoas releases, allowing the spine to lengthen for the diaphragm to ascend as the breath goes up and out. So you go inhalation, arch in the back, exhalation, lengthening. There's this sense of prana being drawn deep into the body with the inhalation, but also moving upwards and outwards with the exhalation. All of this is moderated by the psoas. The movement of the diaphragm moves the psoas, and the movement of the psoas supports the diaphragm. And again, the message from diaphragmatic breath to the nervous system is one of health and ease and balance. And so it's productive in releasing the kind of tension that otherwise leads to back pain through its influence upon the nervous system, as well as the very physiology of the spine itself. A couple suggestions of just simple things, and this exercise shown here is probably one of the most used exercises for people working with chronic back pain, assuming that it's not so bad that they can't even do this exercise. But the idea, sometimes we call this the sun dog or different things like that, being on hands and knees, extending the leg back and then bringing the leg down and forward towards the chest, ultimately flexing the spine, is going back and forth between extension and flexion, increasing the mobility of the spine, but at the same time, maintaining the integrity of the curves of the spine. It's working primarily with the multifidi, but is also influencing the psoas. A little bit more advanced versions, like the one at the bottom, where she extends the opposite arm forward as the leg goes back, and you go back and forth between rounding and arching, and extending the leg. And a key point to pay attention to here is you'll notice in the illustration, when she extends the lifted leg back, it establishes the curves of the spine, and that's essentially activating the multifidus muscles primarily. When you work the arm forward, that works the upper back and the neck and the multifidi, as well as the lower back. And the psoas is participating in creating the curves of the spine. Now, you enhance the integrity of the spine if you maintain that curve of the spine, not an extreme curve, just natural curve, as the leg starts to come down and forward. You can see in the second illustration, the knee is coming down kind of passively. And then as the knee passes the other knee, as her left knee passes the right knee, she's still maintaining the curves in the spine until as the knee starts to approach the chest, at the very end, she rounds the spine going into flexion and then goes back to extension. Part of the logic behind maintaining the curves of the spine is that the psoas actually gets to work better as a hip flexor when the spine maintains its natural curve or arch, at least as it passes 90 degrees. If you round the back too quickly, you'll find you can't get your thigh close to your chest. When you maintain the curve of the spine, the thigh moves more freely from the psoas as a hip flexor. And so this exercise involves movement, starting to create fluidity in the spine, but at the same time, it's helping to establish the curves of the spine and set up and maintain that tensegrity to the curves of the spine as you go through movement. And other forms of yoga poses really do the same sort of thing for the spine, but this is perhaps the best example of how a simple vinyasa with the breath can be helpful with that. So that covers working with the lower back. Of course, there's a lot more to be said about how to do your yoga in a way that supports that. A third factor that influences the health of the back, particularly the lower back, is the neck and head position, particularly the typical posture of the forward head, where the gravitational center of the head is forward of the gravitational center of the spine, which causes a lot of tension in the neck as the neck muscles try to hold the head up. But this tension also translates down to the lower back and weakens the lower back. One manifestation here in the guy on the left is with the forward head, you can see the chest collapse downwards. And with that, the curves of the spine start to flatten. This line kind of describes what's called the lower cross syndrome, which shows the relationship between upper and lower body and the influence upon the muscles. There's like a fascia line that goes from the front body through the rib cage, but also kind of merges with a fascia line through the back body, such that the more the chest is drawn down, the more there's an exertion upon the lower back that makes the pelvis tuck through a tightening of the hamstrings and gluteals and the lower back to start to flatten. That's one response to the forward head. Another thing people do when their head is forward is they'll often tilt the rib cage backwards so the head sits on top of the spine like this, especially if you're holding up a lot of weight in the front chest. In that case, the person is more lordotic in the sense that the rib cage is tilted backwards, and that creates compression on the lower back that can cause pain. In this case, with this guy, his rib cage is tilting forward as the head goes forward. In both cases, it's a problem for the lower back. And I show on the right, there's a point at which the multifidus muscles stop at the second cervical vertebrae, because again, their job is to hold up the spine and maintain the curves of the spine. Above that, you have muscles called the suboccipitals, which control the tilt of the head. And they're meant to allow the head, the skull, to move independently of the spine. So you can tip your head and even rotate your head without necessarily there being any movement in the spine itself. The problem with the forward head is these suboccipital muscles start to tighten and clamp the head down on the spine. And that actually gets in the way of the multifidus muscles properly holding the spine up. The more the head is pulled down on the spine, the more the multifidus muscles weaken by getting cramped up as the head goes forward. And you build up a lot of tension in other muscles like the trapezius that take over the job of stabilizing the head. And you even have problems with the vertebrae slipping forward, which in the extreme can result in a dowager's hump. So it affects the neck as well as the lower back in a number of different ways. So we do have to pay attention to correcting the forward head posture. And this can be done with thought and imagery, with a little extra encouragement, sometimes working with resistance. But the idea is to get the head to release back and up. So you let go of the hold of the multifidus muscles at the base of the head. And as the head releases back and up, you can start to strengthen the multifidi to pull the neck bones back into the proper place. So it's actually a two-step procedure. Release the suboccipitals and work the neck to bring the head back from its forward position. You can kind of do this with your hand on the base of your head, and even imagine with the soft feeling of the hand, it's like a balloon at the back of the neck. And you might first tip your head back against the balloon a little bit. As you do that, supported by the hand, it's starting to activate the multifidi. And then with the hand, you can gently pull upwards as if the balloon is floating upwards. And that floating upwards at the base of the head gets the multifidus, gets the suboccipitals to release while the multifidi stay activated, and you come to a place of a nice upright head. A couple of the extra dotted lines that I have in the illustration are meant to indicate if we release jaw tension, this works a lot better. If our jaw is closed or the teeth are gritting or tight, or especially if your teeth are situated in such a way that you hold jaw tension, it often happens with age, the teeth get ground down. That gets in the way of that adjustment. And try to, if you take your hand behind your head, relax your jaw, take your head back a little bit into your hand. This is going into a little bit of extension. Bring your head on top of the spine. And then with the hand, float the balloon upwards with the jaw relaxed. And you'll feel your head kind of slide back in your hand and up. Now, compare that with taking your head forward, close your jaw and clench your teeth so your jaw is a little bit tense, and do the same adjustment. Tip the head back, draw up with the hand. You'll find the tighter you clench your teeth, the more your neck resists that adjustment. So in working with the neck, jaw tension is an important part of that release. And that actually comes with the Ujjayi breath in yoga practice. The figure at the right is showing how this might be done a little bit more isometrically in a chair with the support for the upper back, where against the hands pressing forward on the head, very gently, tilt the head back to activate the multifidi, and then lengthen upwards to release the suboccipitals. And that brings you into a nice upright place. Anytime you catch yourself dropping forward and down, you can make this little adjustment, whether it's when you're stopped at a stoplight in your car, which is where this especially becomes a problem, or just sitting in your chair. You may notice in driving a car, your lower back gets weaker and flatter, and a lumbar support doesn't really help. The problem with the back is that while you're driving, your head goes forward and that collapses the back. We need to adjust the head back and up with a little bit of resistance, and you find that makes your lower back stronger. So there's a lot to be said about the neck there and its effect upon the back. The last 2 points, like I said, I went a little over a half an hour on this, have to do with the abdominals, because you hear a lot about how abdominal tone is very supportive to health in the lower back. And the result of that finding was to send a lot of people to the gym doing sit-ups to get stronger abdominals. And some people found that did help to relieve the back pain. With some people, perhaps from overdoing it, it made their back pain worse. That's just using the abdominals for flexion or for sit-ups. And yes, that does have a role with transverse abdominals and to some extent rectus abdominis, but that your sit-up muscles tend to pull you into flexion. A really vital aspect of the abdominals that's not really focused upon enough is the action of the abdominals that are involved in twisting action. And this twisting is really one of the most natural movements that we do as human beings. We do it when we walk, and we actually first learned it when we first began to crawl. And it's called contralateral movement. When the guy is walking, his hips turn one direction, his chest turns the other direction. So there's a constant twisting of the two ends of the body, two segments of the body, twisting relative to each other in order to keep yourself facing forward. We first learned that when we first learned to crawl. Before that, children have what's called homolateral movement before they crawl. It's like the two sides of the body work independently of each other. He moves one leg, that arm moves the other leg. It's like the two sides function separately. When a baby starts to learn to crawl, it starts to learn to move the arm and the opposite leg to get that locomotion of crawling, and there's a twisting that comes with that. And that's part of a learning process, but that connects the two hemispheres of the brain and coordinates the brain as well as the nervous system. And we carry that forward into walking. Children that don't get enough time learning to crawl often carry forward non-optimal patterns in their walking because they didn't have time to learn that. And I think this natural twisting action is quite vital to the tensegrity and health of the spine that we've been talking about. It's this twisting action that keeps the spine light and juicy. And it's working all of the muscles and ligaments around the spine that help to maintain the space of the spine that we saw at the beginning. So the benefit of contralateral movement, the benefits are many. First of all, that twisting movement keeps you aligned with the central axis of the body. So your sense of balance is better, especially if you don't have a forward head, and a sense of center is maintained. So older people that lose that contralateral movement have more problems of falling down or starting to lose their sense of balance. Gravitational forces are transmitted through the joints with minimal wear and tear. When there's not a twisting movement, there's more of a kind of pounding on the joints in the hips and knees, even the ankles, as well as upon the spine itself. And it's also more efficient movement. We use less energy in the body for movement, so we experience less fatigue and we have more energy to continue in what we're doing longer, especially because the neck doesn't have to work so hard to keep the eyes level. Now, this is something that's learned as part of our growth process. It's also something that can get forgotten. And we can actually revert to homolateral movement. And you see this in people who walk not so much with this sort of twisting action, but more like they're teetering from side to side. And so the fellow in this illustration, he's balancing his weight on his left leg. And because the hips and the torso are not twisting, because of that flexion of the upper body, he's basically balancing on his left leg, but as he lifts the right leg, he's using his hip flexors to lift the leg up, which kind of pulls his chest towards that leg. It tightens up the hip flexor, including the psoas muscle. And now he's spending a lot of extra energy tilting from side to side as he walks. This person, again, is not using the psoas well, so he's more likely to start to shuffle the feet. He has less sense of a center of gravity. If he tends to favor one side, that's going to affect his balance. Again, there's more wear and tear upon the joints, the knees, the hips, as well as the lower back with a side bending movement. And as I said, the psoas is being overused, and you're just spending a lot of extra energy in the body, which is exhausting to the body. Plus, as the torso tilts from side to side, the head has to adjust for that. So the neck is constantly tilting from side to side just to keep the eyes level. So you end up with shoulder tension, neck tension, even jaw tension comes from that. And it's no wonder you're tired out after a short walk. So restoring contralateral movement is key in many, many ways to maintaining the health of the back and also reducing the kind of stresses upon the body that otherwise lead to different patterns of chronic pain. And the abdominals that are involved in this natural twisting movement in walking are more the oblique muscles, which are closer to the surface of the body. This guy, as he's walking, the external obliques, a big set of muscles shown in the middle that start at the line of the pectorals and go all the way down to the pelvis. And they're used especially to rotate the rib cage. So as he rotates his rib cage to the right, it's contraction of the external obliques, turning the rib cage in that direction. The internal obliques are down lower, and in this action of walking, his internal obliques are involved in the rotation of his pelvis, his lower belly to the left, as his chest turns to the right. The balance between these two obliques kind of working against each other or in opposite directions is not only sort of hydrating to the body, relaxing to the body, but also very centering, keeping the center of gravity. So all of the benefits we just mentioned follow from that. Twisting in yoga is meant to help reestablish that contralateral pattern. But when you see misalignments in twisting, like in this illustration, the misalignment is coming from the fact that he's not really twisting so much as he's rotating. So as he turns to his right, you can see this kind of collapse where the left chest is pulled down by the external obliques, but also his pelvis is turning in the same direction as his chest. So as I turn to the right, the left sit bone gets light, the right sit bone gets heavy because the hip bones are rotating and shifting as the pelvis turns with the chest. This puts pressure on the sacroiliac joint as well as putting sideways pressure on the lumbar spine, even causing the vertebrae to rotate in a way, especially L4, L5, which is not so great on the lower back. So you can go deep with that, but it's not really a twist, it's a rotation, and he doesn't get the benefits of a twist from doing it that way. A genuine twist follows the same logic as walking, which means the two ends of the body turn in opposite directions. That's kind of the definition of a twist. If both ends go in the same direction, that's a rotation. Both ends go in opposite directions, that's a genuine twist. And so in twisting to the right, I can concentrate on establishing the arch in the back, turning the lower belly a little bit to the left to keep the weight on the left sit bone. So it's as if I'm turning the pelvis slightly to the left, sit up tall, and then against that, the chest turns to the right, turning from the external obliques, while the internal obliques stabilize by going in the opposite direction. And that's supported by the action of the muscles along the spine, the multifidi, as well as others. And that twisting action, again, kind of juices up the tensegrity of the spine such that when you really do a twist, you seem to get taller and taller. It's as if the vertebrae spiral and lengthen upwards. Whereas when people simply rotate, they kind of get pulled down and get shorter instead of taller. So this use of the oblique abdominals in twisting is key to the tensegrity of the spine and also key to stabilizing the sacroiliac joint and spine so you don't create the kind of instability that leads to back spasms. And I'm suggesting in the illustration on the left that many poses that we don't necessarily think of as twists, we would benefit from treating them as twists. Like in the Warrior Two, it's kind of old school to emphasize squaring the pelvis so the pelvis would face forward towards the screen as you look at it, when actually for her, the woman on the left, to get her right hip open, The pelvis and the lower belly have to turn a little bit to the right. So the internal obliques turn to the right. And then against that, I kind of have the hands at namaste to emphasize this. The chest turns a bit to the left in order to extend the arm out fully as you look to the right. Otherwise, when you try to square the hips, it kind of pulls the chest with the hips, and then people end up in a misaligned warrior two. A lot of yoga poses, apart from the symmetrical ones like Uttanasana, Prasarita involve a twist using the obliques. It both makes the pose feel better, and it's also healthier for your back. And it reduces the concentration of rotation on particular vertebrae. L5 and L4, the first vertebrae of the lumbar spine, are capable, especially L5, of turning more than the other vertebrae. So if they're not synchronized with the other vertebrae, they turn too much and it starts to wear down the disc. This twisting action using the abdominals reduces those shearing forces put upon particular points of the spine and maintains the health of the spine overall. So that's point number 4, the abdominals and twisting. And the last point, which is more than I can cover here, especially since I've gone over time anyways, is to look at postural factors, postural habits, which weaken the muscles of the body and lead to these sorts of side shifts, tilts that tighten up the psoas muscle, weaken the multifidi, so on and so forth, all of which lead to back pain. So a common posture is kind of like our relaxed, or what I call it, our sexy posture, when you stand with your hips shifted off to one side, like the woman on the left. A little bit exaggerated in this illustration, but you get the point. Very few people stand in a perfect Tadasana. We kind of relax and hang into one hip. It starts to cause a whole series of effects in the body. In her left hip, the gluteal muscles, the abductors, are weakened. The psoas muscle starts to shorten up because as her hips go to her left, her chest shifts to the right to keep the body centered. And with that, the rib cage starts to tilt a little bit. So you can see on the left side of the skeleton, looking from his perspective, his left, there's a shortening between the hip bone and the ribs because the ribs, the chest itself is tilting towards the hip bone as the hip bone tilts up towards the ribs, all of which is shortening psoas, iliopsoas, quadratus, all of which pull upon the spine and start to lead to back spasm or back pain. Also affecting the shoulders, dropping the shoulder down, causing fatigue in the trapezius and the neck. Just kind of a perfect storm for the back, as well as limiting the action of the hips. And there are remedial actions that can be practiced to balance out the action of the muscles on the two sides of the body. There's actually a fascial connection shown here in the anatomical illustration that goes crosswise through the body through latissimus, the big muscle at the back that attaches to the inner arm that we use when, for instance, we push down through our hands to lift ourselves up. We're using latissimus to do that action. The fibers of that muscle go from latissimus down into that white area of fascia in the lower back called the thoracolumbar fascia, which is kind of the roundhouse or the train station for translating forces from one side of the body to the other. In people with chronic back pain, they've found that fascia, the thoracolumbar fascia, tends to be thicker and tighter and doesn't move as much. And as it's thicker, it presses upon the nerves in the fascia. It also, as it gets tighter, reduces your ability to twist. There's not that juiciness of the twisting action. And so it's both a cause of chronic back pain in the lower back, as well as a kind of manifestation of the tightening of the body that's leading to that. The fibers go from latissimus through thoracolumbar fascia to the gluteals on the opposite side because we use that connection in walking. When the shoulder draws back, latissimus is drawing the shoulder back, the hips are turning the opposite direction from the action of the gluteals. So they're related to one another. And so this is one example of abduction. He's standing next to the wall, has his hand up the wall, is kind of pulling down with the hand to engage latissimus while he's balancing on the left leg, the right foot slightly lifted, and pressing to the side against the wall. And the more he presses with the foot, the more it makes his left leg work. And after this lecture, you can give it a try standing next to the wall and try it on both sides, doing one leg, then the other leg. You may find for one hip, it feels like a lot of work, like your hip really burns up on you. And on the other side, it doesn't feel like much. That tells you the one hip is weaker than the other, probably because of your postural and perhaps your movement habits. This is kind of a remedial exercise for strengthening the weaker hip by standing on the leg and challenging it to remain steady as you push the foot sideways. We also use abduction, abduction in yoga poses to balance out and strengthen the outer hips. That helps the hips to remain more centered, which helps to maintain the integrity of the spine. It also works on the other side. As he's pressing his right foot into the wall, he's also activating the abductors on that side, but also breathing into the left chest, kind of reducing the shortness that's otherwise showing up in his left chest on the left side. This is an exercise that's especially useful for working with the scoliosis and the side bends and rotations of the spine that come with that. And so that action with the breath, breathing into the left chest, is also addressing the shortness of the quadratus lumborum that we saw from that side shift. And the QL, quadratus lumborum, which connects from the lower ribs to the top of the hip bone, is a muscle that contributes a lot to chronic back pain by being tight, especially when it gets tighter on one side. I call it the first cousin of the psoas because we actually use the quadratus more in side bending, and the psoas goes along with it. And tightness in the quadratus from side bending also translates into tightness in the psoas, which affects the spine. So this is looking at this from the perspective of the back body. Believe it or not, that kind of finishes what I had to say with the notes. And I know that's been pretty extensive. But I really wanted to point out that these are 5 essential features to look at as being intimately related to chronic back pain, things that are not necessarily emphasized as much. And also these are things that are very clearly addressed through all of the features of yoga practice, including breath, as well as asana, and even to some extent bandha as far as working with the pelvic floor and the vocal diaphragm as well. So all of this is kind of like yoga addressing that. I know there were a lot of questions along the way, and I don't know if Eva wants to pick some out.
Yes, I'll pick a couple out. Thank you so much, Doug. I was streaming both into Zoom and Facebook Live, so you haven't seen all the accolades on Facebook Live. Like, oh my God, this guy is amazing.
I was just focusing on talking, so I didn't see it. That keeps my head the right size. Thank you.
Yeah. Now all the accolades are coming in here too. That was just like but you sort of always deliver above the expected, but then you sort of expect to deliver over the expected, and you deliver over the expected.
Expected, unexpected.
That was absolutely awesome. I wanted to go back, Mary Lou Stillwell. The question of twists always raises a lot of red flags.
Sorry, question of what's?
Twisting.
Oh, twisting, yes.
Yes. So Mary Lou, let's take a question from Mary Lou Stillwell. She says, she's a physical therapist, and she says, please emphasize the need to start these twists slowly and lift the spine first before you twist. It's not a contest to see how far you can twist around.
Yeah, I'm sorry, go ahead.
Yeah, and she says it's important to listen to your body and not over twist. Yeah. And context, of course, is, in particular, people with osteoporosis are concerned about twisting postures. And I think what Mary Lou is pointing out is there's twisting. If you twist with a straight spine versus twisting with a rounded forward bended spine, those are 2 very different things.
Yeah. I mean, first of all, people may have a misconception that you get more benefit the deeper you go into a twist, which is not really true, especially if you're dealing with inflexibility. So not forcing the twist is vital. Second of all, when you support a twist, like for instance, the one that I showed, if you're doing a twist in a chair, you can have your hands on the seat of the chair to lift yourself upright, or if the hand is behind you, you're using the hand to support the curve of the spine. I often go on fingertips because often people put the hand down flat and they kind of collapse and twist like that. So lengthen the spine, traction in the spine is always vital. You want to establish greater and greater length, and that's why I emphasize feeling that you're getting taller as you twist instead of feeling that you get shorter. And then with that support to the lower back, there has to be some engagement of the abdominals as you lift the chest to allow a sense of movement without collapsing in one spine or the other. So thank you for bringing up those points because they are vital, particularly in relationship to flexion of the spine and osteoporosis or osteopenia that often go with that because it's vital to maintain the space and the length of the spine and emphasize that first, even before you think about turning or twisting. And so that traction can come in different ways, pressing with the hands to lift up. In some cases, you might use some other means to pull yourself up and twist, for instance. And the breath is certainly a support in that too. So there's a lot to be said about twisting and a lot more to be said about exactly how you get the abdominal muscles to engage with a lifted and open chest in order to get a more integrated twisting of the spine. Because otherwise, when people just try to pull themselves into the twist, even if they're trying to restrain the pelvis, all of the strain goes to one particular segment of the spine, usually around L4 or maybe T12. And so they end up hurting that particular part of the back or kind of throwing off the sacrum. So you want to get the whole spine to twist in a balanced, integrated way. And you get that by twisting more slowly, not going fast for the deep twist, but taking it slow. And as she was saying, listening to your body. And again, feeling that you're getting taller, lighter, longer as you go into the twist. And once you cease to have that feeling, back off and establish that feeling of space before working with it. And there are many ways to work with a twist, but we certainly have to keep those sort of contraindications and cautions in mind to make it work well.
Wonderful. Great. And one more question. As you noticed, a lot of people have lost, particularly as we get older, people lose their contralateral gait. And Nita is asking, how can we practice that contralateral gait for older people once it's lost? And it's particularly important question since we know walking speed is very highly correlated with mortality. Yeah. So that contralateral walk is just, in so many ways, an important health and wellness measure.
Yeah, a little bit of dance wouldn't be bad for them. Have a little dance, but it's really about getting enough lift and support from the upper body to start to reestablish that twisting action. So you might have parallel bars or something. The problem with a walker is people support themselves in the front of the body with the walker, which just reemphasizes that flexion of the spine that makes things worse. And so there needs to be a sense of lifting with the side body, and that gets into that connection of the fascia I was showing at the end, where when you're able to press down through the hands in a way that lifts the upper body, that supports the action of the pelvis and the gluteals to start to return to that sort of twisting action with support of the hands. So depending upon the level of rehabilitation you're working with, you may have to find some way to reemphasize that, and the possibilities are probably more than I can get into right now. But there are ways of, even while practicing in a chair, to use the support of a chair and chair yoga, again, with the help of the arms to create enough lift that you start to play. And of course, you'd be working with a turn of the chest, but with the neutral curve of the spine, you might be able to emphasize what's happening in the abdominals and get a sense of a subtle twist of your belly's turning one way and your chest is turning the other. Just small movements like that, just to start to get it going. And then taking that forward into walking.
Even just like a seated action to strengthen.
Yeah, and often people sit in the chair, there's no support from the arms, so there's a lot of compression in the spine. Again, use the arms. I mean, this is true in yoga poses too. Use your hands as a foundation because it creates that length in the spine that creates enough space for that movement and that rotation. And of course, establishing good breathing patterns is essential to this too, because your diaphragm is a postural muscle. And when you strengthen the upper body and the back enough to help support a more upright posture, then the diaphragm becomes a key ally in creating that lift and space in the spine so the spine can start to return to movement. But if we're collapsing into the chest and simply breathing with the rib cage and the diaphragm is kind of stuck stagnant and can't move because the rib cage is collapsed upon it, then it's working against you instead of for you, or at least you're not getting that help and that support.
Yeah, excellent. Wonderful. Well, thank you so much. There was 30 minutes, just flew by. Wonderful presentation, Doug. Really appreciate it. And everyone joining us, thank you so much. We will be working on getting the recording ready. And if you have any additional questions, send us a note at support@yogauonline.com.
I do want to mention one person was asking about my books if they're on Amazon, and I'm not doing that. My books are available through my website, doyoga.com, but Amazon, that's too complicated.
So doyoga.com. So again, Doc, thank you so much for sharing so generously of your wealth of knowledge. And we talked before we started about the need to take yoga to the next level and have kind of a standardized set of knowledge. And you certainly represent kind of the gold standard of where we want to get to as a profession. So thank you so much for sharing. And we can't wait to have you join us for our large course on yoga for a healthy back with, all the opportunity that entails to take a deep dive into all these, the applied value of everything you were just presenting. So thank you so much again. And everyone, thanks again for joining us.
Thanks to everybody for coming. Thank you.